will be on cell-based biologics, and then the other, which I was supposed to give yesterday, was more of a sort of a generalized topic on biologics. So I'm going to focus this talk mainly on the evolution of this product category. We'll get into some mechanisms, how we should think about this as a category, and then I'll save the sort of pertinence of this category in the grand scheme of biologics for the second talk. So. These are my disclosures. None of them are relevant to cellular-based biologics in particular. The U.S. bone graft market has dictated that there has been growth in the use of CBMs. I would argue that over the past 2 or 3 years, they probably have tailed off to or plateaued, I would say. We are having some issues in the Chicago area with insurance rejections and that sort of thing. The cost obviously is going to be an issue that we'll speak about. But certainly it comprises a good portion of the use of the use of biologics when we look at spine fusion. The burden of proof in my mind should really come down to these 3 things. My laboratory at Northwestern was very active in cell-based biologics about 10 years ago, and we've had some challenges in sort of continuing this, but reviewing all of the data is important in convincing our mind that this product category does work and leads to bone healing. If one looks at the availability of data, there's not a great deal of it, even though this is on the formulary of every hospital in the United States. But when we think about these types of cells, they can come from either primarily adipose or bone marrow sources.